This is a quick, simple example of a cranial nerve assessment. We start with cranial nerve number 1, the olfactory nerve. This is a sensory nerve that controls the sense of smell. For assessment, we simply test the patient's smell. Place a specific scent under the patient's nose and ask them to identify it. If the patient correctly identifies the scent, the olfactory nerve is considered intact. Next, we check cranial nerve number 2, the optic nerve. This is also a sensory nerve. It controls central vision. For assessment, we're going to test the patient's acuity. In this assessment, we used a pocket Snellen chart. Ask the patient to read the chart. If they're able to read the chart and the patient's vision has not changed from their normal baseline, the optic nerve is considered to be intact. Next, we check cranial nerve number 3, the oculomotor nerve. This is a motor nerve that controls pupillary constriction. For assessment, check to see if the pupils are equal, round, reactive to light, and accommodation. For this, you're going to need a dark environment and a pen light. Have the patient look straight ahead while you shine the light in one eye and then the next. If the pupils are equal, round, and constrict when the light shines on them, the oculomotor nerve is considered to be intact. Next, we test both the trochlear and the abducens nerves together. Both are motor nerves. The trochlear nerve moves the eyeballs down towards the nose, and the abducens nerve moves the eyeballs towards the side of the face. Instruct your patient to follow the tip of your fingers with his eyes only. If he's able to do this, cranial nerves 4 and cranial nerve 6 are considered to be intact. Next, we check cranial nerves number 5, the trigeminal nerve. This is both sensory and motor. It's sensory for most of the face and controls movement of the jaw. To test the motor portion of the trigeminal nerve, have the patient open and close his mouth while you apply gentle resistance. For the sensory portion, have the patient close his eyes and ask him to tell you when and where he feels you touch him. Then gently touch his cheek, chin, and forehead one at a time. If he is able to correctly identify the areas where you touched him, the trigeminal nerve is considered to be intact. Next, we check cranial nerve number 7, the facial nerve. This is both sensory and motor. It controls facial movements and taste. For assessment, check for facial symmetry and movement and test their taste. Ask the patient to smile, frown, raise their eyebrows, puff out their cheeks, and stick out their tongue. Next, see if they're able to taste sweet and salty or bitter flavors. If they are able to correctly do these tasks, the facial nerve is considered to be intact. Next, we check cranial nerve number 8, the vestibulocochlear nerve. This is a sensory nerve that controls hearing. For assessment, we do the Weber and the Rinne test. Strike the tuning fork and place the end of it on the center of the patient's head. The patient should be able to hear the vibrations equally in both ears. Next, strike the tuning fork again and place it on the end of the mastoid bone just behind the ear. Have the patient tell you when they can no longer hear the vibrations and then move it close to the ear. If the patient can still hear the vibrations, cranial nerve 8 is also considered to be intact. Next, we test both 9 and 10 together, the glossopharyngeal and the vagus nerve. Both nerves are sensory and motor, and both innervate the tongue and throat and assist the patient in the ability to swallow. To assess, check the gag reflex and swallowing ability. Give the patient a drink and note any difficulties he may have swallowing. Next, test the gag reflex. If the gag reflex is intact and no problem swallowing were noted, both the glossopharyngeal and the vagus nerves are considered to be intact. Next, we move to the cranial nerve 11, the accessory nerve. This is a motor nerve that controls the neck and shoulder movement. For assessment, test neck and shoulder movement. Have the patient move head side to side and then have them shrug their shoulders against resistance. If they're able to do this, cranial nerve 11 is considered to be intact. And lastly, cranial nerve number 12, the hypoglossal nerve. This is a motor nerve that innervates the tongue. For assessment, test tongue movement. Instruct the patient to slide tongue against the side of each cheek. If they're able to do this, the cranial nerve 12 is considered to be intact. And that's it. A quick, simple guide to cranial nerve assessment.